Hi, Derek. How's it going? How are you doing today?
Doing okay, a little tight, a little sore,
A
but
little
doing
sore.
okay. Yeah,
So I hear that you're in because you had your ACL repaired. Is that right?
unfortunately, yeah.
Unfortunately, yeah. Okay.
Um,
Well, what I'm going to be doing here today is what we call electrical stimulation. So our goal with you is to kind of help your muscles learn to work again, especially your quads, learn to fire, because we were seeing that because in one of our tests, and as you had said, you're having a hard time extending your leg, getting your quads to activate. And so that's what we're going to be doing, okay?
yeah, sounds good.
So the indications for this particular patient, he had an extensor lag in his right quad and his right leg. So as well as just general inability to activate his right quad, we're going to be using um, Biphasic Pulsed Current NMES to help the quad learn to fire again. So the contraindications for this would be if you had a heart, a pacemaker, pacemaker, any history of tumors, malignancies, hemorrhages, if there was any open wounds, damaged tissue in the region that I'm going to be applying the electrical stimulation. If it was a female, I would ask if she was pregnant. And predominantly those are the main contraindications to be looking for, as well as decreased sensation of pain or temperature of that skin that I'm going to be applying to, because I don't want to risk injuring because the patient can't perceive what's being put onto the thigh. Uh, okay, so Derek, what we're going to be doing is we're going to be taking these pads right here, and these pads basically are just going to be sending a little electrical current through them. And what I'm going to be doing is applying these pads onto your quad, up like in the middle of your quad and closer to your knee. And using these, we're going to be able to kind of re-educate your quad to fire again. All right.
Cool.
So for me to do that, I'm going to need to place these on your thighs. So is that okay if I lift your shorts up and put my hands on
Yeah,
and put
of
these on?
course.
Okay. Perfect. I'm trying to relax. So you can lay back down if you want. Just make yourself comfortable. All right.
Well, I'm comfy now.
Perfect. So we're going to be applying these near this first one near the.
You're cold.
Sorry, it's kind of cold.
No, you're good. Okay, I wasn't expecting
At
that.
least I know that your skin isn't. You can still perceive temperature. So.
That's true.
Okay. Near the center of the muscle belly and closer to the knee. And my goal is to kind of be specifically targeting the rectus femoris muscle for this particular example. Okay, Derek, so as I put these on, what we're going to be looking for is a little bit of a muscle contraction. So imagine you contracting your thigh muscle as hard as you possibly can. And what we're going to be shooting for is about 60 to 70% of that. So we don't want your thigh to be killing you with the level of contraction, but we want it to be a good, consistent contraction. And what we're going to be doing is going to be on for a few seconds. It's going to back off and then ramp back up, back off, and ramp back up.
Cool.
If at any time you feel abnormal pain or like tingling going further down or up your spine to your foot or anywhere other than on your thigh, you just let me know and we will stop the treatment immediately and just kind of reset and try again. All
Cool.
right.
Yeah, that works.
So for the parameters over here, since we're using biphasic pulsed current, what we're going to be doing is put them onto biphasic. I'm not sure if you can really see that very well. Maybe tilt it down just a little more. There we go. You're right about there. Okay. So for sake of the recording, I'm going to put him on a duty cycle ratio of 10 to 10. So 10 seconds on, 10 seconds off. If I were in normal therapeutic setting, I would at least put him to 10 over 30 or 10 to 50 ratio. And we're going to increase this ramp time to make it more comfortable so he's not just instantly pushed up to the max and then instantly drops. So for the time, we're going to keep him at 10 minutes. Usually we would keep him there for at least 10 to 20 contractions. But for this given video, we're just going to do a couple contractions. The frequency or the rate, sorry, we want it to be at least 50, from 50 to 80 pulses per second. And the width, we want it to be at least 200 microseconds. The range is usually 200 to 800 microseconds. Alrighty, Derek. So at this point, we're going to be increasing the intensity to a good muscle contraction. So I'm going to start increasing this, Derek, and just let me know when you start to feel a little bit of a tingling sensation, okay? And in the beginning, I would be increasing this pretty slowly, especially if it was the first time for a patient. But later on, we would want to increase it pretty quickly so that the tissues don't have time to adapt later on. Right there? Okay. So I'm going to keep going, and I'm going to keep my eye on his quad as well, so that with his perception of his contraction, I can also look at it to see how well it's contracting.
I can definitely feel that. It's not contracting, but I can feel the tingles getting stronger.
Okay, good. Let me know when you start to feel it like kind of twitching a little bit.
It's getting there.
It's getting close. All right.
Yeah.
Still increasing nice and steady.
Yeah, I can feel a twitch. You might not be able to see anything, but I can feel a twitch.
Oh, there we go. I can start to see the twitch.
Yeah, there it is. Well, that's weird.
Yeah, doesn't it feel weird?
Yeah, it doesn't hurt.
Is it
just feels
painful
weird.
at all? It just feels weird. Okay,
No.
good. Good. It's starting to twitch a little bit more.
My wife thinks I can't dance. That thing dance.
So we want a good constant contraction, not super horrible though, right?
Yeah, right. I can feel it contracting right there.
So right there feels pretty good.
I'd
Okay.
say so.
We'll go ahead and stop it there, or stop increasing, and we'll start the treatment. So it'll be 10 seconds on, it'll ramp up, 10 seconds on the contraction. After those 10 seconds, it'll ramp down and pause for 10 seconds, and then repeat that cycle.
Yeah, now it's gone.
Now it's gone, perfect.
Closer look at the contraction if you want to try it out.
And so after the second contraction, I'll look at it too, but let me know when this one's done.
Yeah, just starting now. There it is. Now it's gone.
Okay, all right, Derek, we'll just stop it right there then. How did that feel? What would that feel like?
Yeah, it was good.
No pain, nothing.
No.
Everything was just kind of centralized on your thigh.
Like small contraction. I guess I maybe could have told you a little higher now that I think about it, but it was still pretty good.
Right, and that's totally fine with your first time. Now you kind of have a better idea of what it feels like, right?
For sure.
So I'm gonna take these off. I'll take them off quickly so it doesn't tear too many hairs off. All right. There we go.
Thanks.
Perfect. And so from this point, after this modality, we would probably be just moving on to the next stage of the treatment for the day.